Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is my hip pain coming from a hip or a lumbar spine problem? Well, hip pain is extremely common. There are tens of millions of Americans suffering from hip arthritis, and the pain may cause significant disability with limited ability to walk, exercise. There are close to 300,000 total hip replacements performed every year in the United States. And when pain is occurring in the hip area, it seems obvious to assume that it's actually coming from the joint itself. In actuality, it may not be coming from the hip joint. When pain is being felt in the hip, there may be an overlap in symptoms between hip arthritis or a hip joint problem and lumbar spinal stenosis. As individuals age, spinal stenosis is very common, just like hip arthritis, and both occur from degenerative disease. Lumbar spinal stenosis occurs with degeneration beginning with the intervertebral disc, and then that leads to arthritis in these joints, the facet joints in the back of the spine. This is the intervertebral disc. So when that degenerates, it starts to see abnormal motion in these joints and degenerative disease. And then this area is normally circular. That's a spinal canal, but it starts to become more triangular and pinched from overgrowth of soft tissue and bone due to arthritis. And the pain that is experienced from the spinal stenosis may mimic hip joint arthritis pain. So how do you differentiate between the two? Here's looking at spinal stenosis from the side. You have soft tissue growing out from the back and bony disc that's been calcified coming back from the disc space. So the end result is that it starts pinching on nerve roots with spinal stenosis, and you can see a cartoon of just that right here. And here's a pelvic x-ray showing you a normal hip on this side where you have nice joint space here with the arrow, and then decreased joint space from arthritis. Here you also have some cyst formation inside from arthritis, and this whitish appearance is called sclerosis, and that's indicative of arthritis as well. So history may differentiate between the two, depending on where the pain is, how long it's been going on, when it comes, when it goes. Both of them can cause referred pain that goes down the leg. Some patients will say, well, you know, I feel okay when I'm in the grocery store leaning over, or when I'm walking upstairs leaning forward. Those are more indicative of a spinal stenosis problem, because when the back leans forward, it opens up the spinal canal. Physical exam can be very helpful as far as if it's point tenderness over the hip joint region, range of motion pain in the hip with the hip, then that can be indicative of hip arthritis. But a neurologic examination, not usually very helpful. Imaging studies can be great. They don't tell the whole story though, but I showed you the pelvic x-ray, and here's an MRI looking down. You have the intervertebral disc here, spinal canal, which is supposed to be circular, but here it's more triangular, and that's because there's spinal stenosis. You have overgrowth from arthritis here, and it's pinching, okay? And this is actually the same thing with thickened soft tissue as well. Now, plain films of the spine can show arthritis, but they don't really show spinal stenosis. An MRI shows something like this, but a lot of patients may have imaging films that show spinal stenosis. That doesn't mean they're going to have pain. There's not a huge correlation between an MRI that looks like this and someone in pain. This is the same x-ray from before where you have the arthritic hip and the normal hip. So with the imaging studies and the physical exam and the history, you can get most of the story, but it may come down to where you need diagnostic injections. You may need a hip injection, and if you have a hip pain and a hip source of pain, then injecting into the hip should decrease the pain within minutes, okay? You should know right away. Epidural injections into the lumbar spine where the nerves are getting pinched, such as you see right here, may not work right away. It may take a few days to take effect, or it may take a second injection to actually get some relief. So here's the potential outcomes. If you get complete hip relief with a hip injection, that means you have a hip problem, okay? That just goes right hand in hand. Now, if you get complete hip relief with an epidural injection, that means you have a lumbar spinal stenosis problem, okay? So complete hip relief depending on which procedure. Now, if you get some relief from a hip injection and then you get the rest of the relief when you do an epidural injection, that means you have a combination issue, all right? And that happens a lot. You have hip pain from hip arthritis and also lumbar spinal stenosis, and they both come from degeneration and arthritis. And there is always the possibility that neither injection will work well. In that case, further investigation is necessary because it may be that something else is going on. Well, there you have it. The Nevada Pain Network has the best pain management doctors in the greater Las Vegas, Henderson Enterprise area, offering medical and interventional pain management along with chiropractic, physical therapy, acupuncture, and spinal decompression therapy. There are several locations accepting over 50 insurance plans. The pain management doctors are board certified. They have won the Patient's Choice Award 5 years in a row based on their high level of skill and excellent bedside manner. The number to call for scheduling is 702-323-0553, and visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.